I wanted to talk to you a couple of minutes about the staging of lipedema, because to me it really doesn't make sense. So the staging of lipedema is based on the shape of the ankles. If you have no significant swell of the ankles, then it's stage 1. With more significant, it's stage 2. And then it goes up to the stage 3 and 4 when they're really heavy. But the problem is it does not really translate into anything clinically relevant, because you have patients with really heavy central lipedema, like starting from the knees up and including the lower portion of the abdomen, and on the ankles it still could look normal, so it's technically stage 1. But at the same time, the thighs and the hips are stage 4 and look and feel terrible. So from my standpoint, the staging system really does not properly address the way the lipedema develops. And I think the new staging has to be devised, one that would include peripheral versus central location of lipedema, the one that would describe earlier onset, later onset, and also the one that would probably deal with the size of the lipedema nodules. And I think I need to make a separate video on the size of the lipedema nodules. A lot of people talk about them, but I think we need to really separate them into 2 categories. Ones that can be removed with liposuction and one that require actually special treatment separately from it. And at that point, it's probably close to Derkham's disease if you don't know what it is. So I just wanted to tell you that when you look at the staging system and look at your legs, you may be stage 1 for the ankles, but you could be stage 4 from the central component, from the upper thighs. So unfortunately, I would say that the staging system is outdated at this point, is really not clinically relevant. We're still using it, but it's not clinically relevant any longer.